Alyssa here, Swedish therapist. This is for headaches. Um, so if you see over there, this guy, he doesn't have that guy. He doesn't have a head. So I have to show you the headache treatment for on him and me. We're going to do it together. So there is aponeurotic fascia that goes well over all of this. So all of this muscle structure, which is about an inch thick, back here, is covered in deep fascia over the muscles, and then a retinaculum that helps connect everything. And then we have aponeurotic fascia, and I'll have to get the definition and the description of what aponeurotic fascia is. But it is covering over everything. So if you think about how the Indians would scalp people, they would make one cut and then they would pull it clean off. So what we want to do with our treatment is put the roller here. Yeah. So it's not on the neck because you've had that injury with the chiropractor on your neck. We're not treating the neck, but because fascia connects and it makes a continuous continuity between structures, this fascia is connected here. So when we treat this area, then this can have better range of motion because the tension is not there. So that tension gets so very tight, and we have to think about what our shoulders are doing. And when we feel just like life is up here, it's very hard to actually pull this down. And so that tension is locked up in the superficial fascia where there's a lot of sympathetic nerve endings. And it's doing that to protect you, to help that if there's an injury and it's tense, it's going to have a better chance of protecting you with trauma. But that's an emotional thing. So we want to relieve some of this discomfort that the neck is feeling with the treatment on the back of the head. So this is your first self-treatment that you're going to do with your roller. The melt roller that I bought you arrived. So I'm going to show you with this one because I can't do a video with the melt roller because then Sue Hitzman won't be very happy because I'm not a melt therapist any longer. I decided not to pay the membership fee because I couldn't afford it. So I'm going to get on the table and I'm going to show you what we're going to do. All right, hang on. Okie dokie, here we go. So the roller, I know there's a little bit of shadow. I'm not sure how I can prevent that, but I just put my hair up, and where the hair is, this back hairline on the skull is where you want the roller. So if you can see from there, there's nothing on my neck. Now the roller is soft, and the reason that we're using a soft roller is because we want to do something gentle, very gentle. And I can see that, hang on. I moved it just a little bit because I think that might be a better, yeah, I think that's much better. Okay, so you're laying on your bed and you have your roller underneath the back hairline. Now, if you turn your head, you're going to feel your ear right on the roller. So let's start this way first. Yeah. Okay. So you're laying on your side and your ear is on the roller. And now all you're gonna do is lay on your side comfortably. And now just turn your nose up a little towards the ceiling and turn your nose this way. So turn your nose a little to the ceiling and turn and face me. All right. So if you feel your ear on the roller when you turn and look straight forward, you're in the right place. And then when you turn and look up, this is on the same area where the SCM, sternocleidomastoid, is attached. And like the ball treatment, this is exactly where we did the ball treatment to help stimulate the vagus nerve. And the vagus nerve with the enteric nervous system, there's about 80% of the information that comes up from the body and feeds the government. And we take it nice and slow. And you can see the speed of my head turn. It's very slow. Oh, that was 2 minutes. It's time for dinner. Larry's not going to be very happy because he said, do this really quick. But this is not about quick. So now that we've done that side, and it's about 30 seconds to a minute, and now we're either having our legs straight out in front of us or our knees bent, whatever you want. And now we just lift the head up. We're not lifting the head, we're just looking up and looking towards our knees or our toes. So this is a small nod, like you're doing a yes nod. But again, the roller is on the back of the skull. And this occipital base has a lot of attachments from the back all the way up. And it's very thick with muscle and fascia and nerve and blood vessels. And it's not on the neck. So this small little tilt, your head is going up a little bit and then down a little bit. Now, really, we're done with the treatment, except we have to turn and we have to do the opposite ear so that you can see me. Of course, you can just turn on your side and do the other side, but you actually have to see me do the other side. So again, you can see my ear. I can feel the roller. And now I just turn up. And then I look forward. And I turn up. And I look forward. And really, I just want this to be fairly relaxing. We're trying to get the sympathetic nervous system and the parasympathetic to even out. And if we can get the parasympathetic nervous system a little bit happier and a little bit more involved, then it's going to be so much easier for your shoulders not to be up as earrings. And then maybe some of the tension that you have in the shoulders and the neck can also resolve. So this is your treatment. Have fun with it. See what you think. Try it for just a few minutes a day. Really just a few minutes. So have fun. Chat with you later. Bye.